recorded, and that link will be sent to everyone who attends as well. Okay. So thank you all so much again for joining us today. I'm Stephanie Maselli. I use she, her pronouns, and I am one of the professional development co-chairs for WWPR, and I work in communications at National Geographic for my day job. And it's wonderful to have all of you with us today. And just a few things before we start our program. We'll have a dedicated Q&A period, but we are really striving to keep this conversational. So feel free to raise your hands or put your questions in the chat. And like I said, again, this will be recorded and shared with you. So the reason we're here today, I'm very thrilled to introduce Dr. Brooks, who is founder, president, and CEO of SRB Communications, one of DC's leading multicultural marketing and communications agencies. And I invite you all to read her very decorated bio on this event page. We would be here for a while, and I think the awards can speak to that too. And I should add that SRB has been in business for, I think it's 32 years, so a very happy birthday and happy anniversary to you all. And for today's program, this is about inclusive public health communications. We've really seen how COVID-19 exposed stigma, misinformation, disinformation, and inequities that have been here since the beginning of time. But it also presented a real opportunity for public health departments and the comms professionals who support them to really step up, and that includes uncovering cultural nuances and connecting with diverse audiences. And that's an area where Dr. Brooks and her team, many of them on this call today, really excel. So she is going to speak about some of her client work at the height of COVID. That includes case studies from Prince George or PG County and the Howard University CDC Foundation. And as a business owner, she's also going to speak about how she really parlayed her expertise in other sectors, including higher education, to really pivot to public health and meet the moment. And Dr. Brooks, when we connected last week around this time, you said something that really stuck with me. You said a lot of, public health departments are looking at what's next or what's the next big pandemic of this century, but we really can't lose sight of what's going on now. Misinformation is not at all limited to COVID or one platform, and, many public health priorities took a backseat to COVID. So we have a lot of work to do now from a comms perspective, and we're really eager to hear from you about how you're leading it. So with that, I will let you take it away. And I want to thank you again for being here and being a longtime member of WWPR.
Thank you so much, Stephanie, and thank you for the kind invitation and the introduction. I'm sincerely grateful for that invite from WWPR, the Board of Directors, Organization's Professional Development Committee, and yourself. So pleased to see all of our members here today, as well as other communications professionals joining us to discuss today's topic, inclusive communications in times of public health crisis. So let me begin let's level set our discussion for today. SRB Communications has certainly experienced significant growth since the COVID-19 pandemic began 3 years ago. But as we all know, business growth requires 360-degree focus on all elements of the business. That includes everything from executing advertising and marketing campaigns to hiring the best talent, and of course, closing deals. Now that's my job, to lean into that big picture of the boutique agency operations and steer the course of the business to success. So for the first 18 years of the business, right out of the newsroom as a news reporter and anchor, I worked in the business, because working in the business was the professional training that I had gained as a journalist coming out of college and entering my career world. But these past 15 years, I work on the business, and I leave the day-to-day campaign execution to the team. We have a very strong and talented team of marketing professionals and creatives here, and we develop and execute campaigns from concept to completion, from conducting market research to strategy and messaging, creating content and creative development, as well as media buying and placement. And then there's also preparing metrics and analytics for each of these campaigns. Last year alone, we executed 22 campaigns for our 7 to 8 active clients who have multi-year contracts with us. But my job is real simple, everybody. I'm the rainmaker and I'm the closer. So in times of uncertainty, I believe it's crucial for leaders to rally around the why behind their mission. That's why I wanted to level set the discussion, because there's a tendency to overlook the why when decisive action is needed. And we all know we needed some decisive action during the COVID-19 pandemic. That why really illuminates what needs to be done in the business and how it can be accomplished. The why gives your team that sense of purpose. So when you start with the why and you identify the pain points, from there you can develop a plan on how to move forward, especially during turbulent times like COVID-19. The why helps us to unpack what is needed so that we can be adaptable as we move in the way forward. So during the first 6 months of the pandemic in 2020, I spent time thinking about our past, our current situation, as well as our future. Because during that time of change and disruption, it was happening all around us. And like many business owners with full-time employees, we went from 14 to 10, but we didn't have any layoffs or salary cuts, just people moving on. The slow work in 2 of our business verticals adversely affected the client work that we've enjoyed for more than a decade. And you mentioned a little bit of that in the beginning, Stephanie. Recruitment advertising with higher education institutions and Washington, D.C.'s Convention and Sports Authority, Events DC. So I had many days and nights of great joy and sadness. Because as we all know, our country was dealing with the challenges of this global health pandemic, economic uncertainty, civil unrest, and job security. The reason we feel that we lost a few people, all difficult times for each of us as we look to navigate and manage our lives and our business while surviving. But that time, it allowed me to evaluate SRB Communications and lean into my anxieties, the challenges that I faced, and the successes that I had enjoyed for so many years. And with so much uncertainty in the future ahead, I just did what successful entrepreneurs do. I made a list of the goals that I wanted to accomplish during this time, and I pivoted. Within 6 months of the start of the pandemic, we lost $1.3 million in revenues. But we expanded into a new business vertical, public health, that has brought us year to year substantial growth. So we stepped back, reorganized, restructured, and then stabilized. The pandemic paved the way for this change and growth, because for more than 3 years, our growth opportunity now has been in the public health industry. Our utility companies, gas, electric, water companies, all throughout the Mid-Atlantic region, they were growing and they were stable, and we had that work, but we had to find another place. And we found that in telling the story of how COVID-19 and the pandemic, racial stigma and discrimination affected those that are living in historically marginalized communities. And it's important work. So I am very proud, so proud to work with the SRB team and our clients to see these marketing campaigns come to life. Our experience in this business vertical, it includes Project Refocus. It's an initiative conceptualized as this collaborative and community-informed effort that addresses racial equity challenges. Project Refocus, you can find the client on the website at www.projectrefocus.com. We recognized, as did our clients, the need to address racial equity challenges within the public health arena, and that there was a need to monitor stigma impacting those diverse communities. So Project Refocus focuses on community input and mediating the roles of interpersonal communication, media frames, misinformation, as you mentioned in the beginning, in relation to collective health behavior. And these are all factors that are very critical aspects of a successful response to public health crises. So what COVID-19 really has shown us is that public health practitioners need access to data and tools that can help identify, respond to, culturally tailor, and reach underserved communities during a global health crisis. So we partnered with Howard University, the CDC Foundation, the University of California, Los Angeles, UCLA, to help amplify those stories that were going on in underserved populations from every region of the country. And the SRB team, we created tools and resources for civic engagement that help to advance social justice issues during this health crisis. And part of that work earlier this year for Project Refocus was to facilitate and execute a 4-part webinar series that you can also find on that website, again, www.projectrefocus, where we partnered with public health practitioners, partners, community leaders, so that they could discuss the unique challenges, the methods, the tools that can be used to create a more effective response to support really evidence-based decision-making in the context of health equity. And so we are so excited because that work started in 2020, about September of 2020. And when we thought it was going to end last year, it got extended through 2023. And now we have just learned and are excited about the extension that we just received of more of this work through 2024. And then also last year, we executed a marketing campaign for Prince George's County Health Department, as you mentioned in the beginning, in Maryland. And that work there was to address health disparities and advance health equity, targeting 9 underserved, racial, and historically marginalized populations. So what we do here at SRB, we're committed to deepening those connections and trusting the diverse communities that we serve, giving underserved audiences what they need to be intentional about, which is messaging and outreach to those communities. So I'm thankful, I'm grateful, I'm blessed for the many opportunities ahead, not only in this new business vertical of public health, but continuing our long time work over the last 15 years in advertising and marketing campaigns with our regional utility companies. It looks like the Washington Convention Center and some of the sports authorities are really coming back full force. So we look forward to working with them again. And we are so excited about this rewarding new work that has come to us in the last 3 years, because we were able to pivot during this public health crisis. I know I've said a lot here, so let's take some questions now.
Absolutely. And just a reminder, feel free to raise your hand, put it in the chat. And while that happens, Dr. Brooks, I have a question for you.
Sure.
In actually a blog post, you mentioned you coordinated a number of focus groups, and it said 9 diverse populations in PG County. A lot of times people will say diverse audiences or diverse populations as this umbrella term. But how did you go about uncovering the cultural nuances and sub audiences within those populations? Can you tell us more about the research process?
Absolutely, Stephanie. Cultural relevance is always key to a brand conversation. It is so much so because it's important to make an impact on your audiences. What we feel was important here is reach and relevance. So we had to tap into the connections among those 9 populations in Prince George's County, have conversations with people in those communities that are often overlooked in underserved audiences. Not only the African-American community, Latino community, but Amharic and Asian American and Haitian American. We had, there are so many cultures there in Prince George's County, of course, Prince George's County being the leading African-American county in this country. So for minority communities, it really means going where they are. Well, we couldn't go where they are, right? Because face-to-face couldn't happen during COVID. However, we could have the conversations and make the connections. So since face-to-face wasn't happening, we conducted focus groups across the country for Howard University and the CDC Foundation. And we conducted those focus groups first. It was 24 focus groups for that work. And then, of course, for that work, it meant that we had conversations in those focus groups for 60 to 90 minutes with more than 250 populations: African Americans, Latinos, Asian Americans, undocumented workers, and seniors. So we had to work on screening those populations throughout the country, a big process, kept the team very, very busy. And we had to make those connections. And then for the work in Prince George's County, we conducted the 18 focus groups that you mentioned from the 9 populations. But what happens in that research and those conversations and making those connections? It gives us the roadmap that you need to develop the strategy, the creative, to execute the campaign. We get firsthand knowledge of what those folks in those communities are thinking about how, in those cases, stigma, discrimination, racial inequities were affecting minority communities. And that is so important in everything we do. You know, for so long, we see that, or had learned that, oh, if we wanted to look at cultural nuances, you translate something from English to another language. That's not what this means when we talk about inclusive communications in underserved communities. We must go where they are. We must talk to people in the community. We must engage them in conversation so that we can get all of the background and the information that we need in order to make solid decisions for our clients on how to proceed with the campaign and that work.
Thank you for that. Speaking of, client or counseling your clients, we're having this conversation. We talked about misinformation, disinformation, competing information, but we're having this conversation in light of Twitter, for example, announcing that it's no longer enforcing its COVID misinformation policy. And we saw that playing out pretty recently. One example was when Damar Hamlin collapsed on the field in January, and there was this pile-on. A lot of people said, oh, it was the COVID vaccine, the COVID vaccine. So like, how are you counseling your clients in light of a lot of social media platforms kind of not enforcing these policies, or just taking a back seat, or, wringing up their hands and saying, we don't worry about COVID anymore?
Well, it's all about inclusive communication. It's what we're talking about here today. We have to be intentional. So we're intentional about it. It reflects diversity and brand creative and content. Here's the difference with us. Our team is diverse. We live and work in our communities. We were raised in those communities. We live in those communities. So we're confident about the cultural mindset of our customers' audiences because we're there. and we stay there, and we've been there. So as an agency, we help drive cultural standards and values in messaging and creative and content because we are intentional. We know about the authentic appeal that needs to happen in order to influence behaviors, especially those behaviors within underserved communities. And we leverage the power of what we call the untapped multicultural market, which so many don't understand, because the multicultural market is fast becoming the general market. By 2030, it will be at least 50%. By 2050, it could be emerging past 80%. So the makeup of the demographics in this country look different, and diverse means so many different things to so many people. It's not just about multicultural and diverse minority, but it's about seniors. It's about others who have come and live in this country and in our communities. So we tell our clients that it is really important that whatever the brand and the messaging and content is, it must reflect diversity. And our clients believe in that. I have to say, our utility clients have been a leader in diversity, as well as our higher education clients, and certainly the public health agencies and universities that we work with.
Yes, please.
So you had mentioned your role during COVID is to be the rainmaker, and like your role throughout. I had the fortune of selling my company in the first month of COVID after running it for many years.
Mm-hmm.
And many times I thought, thank goodness I don't run a company anymore, because there was so much pressure put on individuals that ran companies to address recurring business. So that was a huge thing. But then also policies about going to work and vaccines and who wears a mask. And so talk us through how you managed that and came out even stronger than pre-pandemic.
Thank you so much for that. I appreciate that, Miss Susan. You know, it was a challenge. There's no doubt about it. We have always had offices in downtown Washington, D.C. For 30 years, we've been everywhere from 14th, 15th, 16th, 19th, and K and back. And that was a challenge because we could not go into the offices. We did not return for 15 months. But when we did return, we put in some COVID protocols. But during that time that we were out, we had to make so many changes. Of course, our clients were requesting that we communicate with them, as we're doing today, virtually. That all of those virtual conversations and their archives and their documents and databases needed to go through a VPN so that it lived on a cloud. We had to put all that in place with our IT company. Once a month, someone would go by the office, get the mail, ensure that things were going fine. Undoubtedly, many times it was me. But because I wanted to make sure I kept the team safe, and that was very, very important to everything that we did. But we had to scramble like so many others did, and this was different from former recessions like we had in 2007 and 8 or 9/11, or the government shutdown in 1995, or other downturns in the economy. It was different. Everything shut down. You had to go home. You had to figure it out. I always surround myself with people who are smarter than me. I've always traditionally had a board of directors, a board of advisors, and that board comes together 2 or 3 times a year to advise me on different things. So we just had to continue to talk with them as consultants instead of really coming together in the beginning, and talk about those things that were affecting us, operations and IT, as well as the workforce, which has really dramatically changed. One of the things that I did not plan to do that we had to do was to move once again. Generally, we move every 5 years. You get a better lease, you move on. But I had been in our place at 16th and K for 8.5 years, and I had an out before that 10-year period. I tried to negotiate with my landlord to see if, as a small business, we were in a building with 8 floors. There were 3 companies that had full floors, and then all the other small businesses. Everybody, when we were going through that, had gone, shut down their businesses, sold their businesses, some like yourself. And I knew at that point I needed to do something, and I had a negotiating out in my in that lease. I did not want to move. There was no way that I wanted to move during the middle of COVID. That meant even more expenses, but I had no choice. And so we looked around, and we only came 2 blocks east and to 14th and K. And we were so blessed that we negotiated a 5-year lease that got us 10 months free rent and a significant reduction in monthly rent, a larger space with 9 to 10 offices. So everybody has their own office, which was going to be important in the comeback. So it worked out, but not without challenges. And the biggest challenge has been the workforce challenge. And I get that. I know it's a new workforce, but I'm a boomer. I come from a different place. I come from a different place of work ethic and values and principles than some of the new workforce, because there's new things, new ideas, visionaries. I get it. But the way we had to work, I had to change things. So when we came back to the office, we didn't come back 5 days a week. We came back 4, 1 day remote. And since then, we have morphed into the hybrid work model, where we're in the office 3 days a week and 2 days remotely. Being in the advertising and marketing world, where we have to be creative and meet and brainstorm and, put those great ideas on the board, or communicate and connect, it is so vitally important that we do that together in person and not just virtually. And I know so many folks have just gone home and are virtual, but we can't see it that way. And we are truly, truly thankful that our clients, they understand they're on that same 3-2 work days. So it is working out now for us, but certainly not without those challenges that I described over that period of time. Any other questions?
Can you also, tell us about how you're continuing your work with local and regional public health departments? What, in that spirit of not just next, but what's now, or what took a backseat to COVID? How has that client work evolved? What does it look like now?
Thank you so much for that question. That's a very good question. And you're right. When we did talk, you said, well, what's next for the public health pandemic? And then I've had that question come to me in many different ways. Well, what's next since the pandemic's over? Where's the work going to go? Public health is here to stay, always has been. There's more to public health than COVID-19. And I guess, we opened our eyes to that once the pandemic occurred. So for the public health work, as I mentioned, we've expanded that work. Now we're going into to another year. We started in 2020. We're going to 2024 with the work with the CDC Foundation and Howard University and UCLA, because that, the more data, the more information, the more gathering of metrics that can be found on how to respond, how particularly historically marginalized communities respond to a public health crisis, because so many times they're among the last to get the information, because so many of them are not on social media. Okay, so many of them do not have internet in their homes. They were going to their libraries or community centers to actually access the internet. So we have to understand that there are different needs in those communities. So that work definitely continues with Howard University, UCLA, and CDC Foundation. Prince George's County is wrapping up some of that work, but there could be some other additional work in that area. But public health spans so much. There's HIV/AIDS. We have a huge problem in the state of Maryland, in the DMV, with fentanyl and opioids. That's all public health. It's killing our young people. So when we look at that and we see that there are so many racial disparities and inequities in our systems, we have to be able to amplify those voices in those communities and tell those stories so that those communities can get the information. It's about building brand awareness and outreach and getting them educated in those areas.
And then also, a lot of members may have more of a traditional PR and media relations background. So Dr. Brooks, can you talk a little bit more about like those principles of market research, uncovering the insight? How could WWPR members incorporate those principles of market research in their work to develop more inclusive and more data-driven campaigns?
And that too is so important, because market research, as we all know, in anything, is so important to any work that you do pretty much in any industry. And I think what has happened to us as small business owners, as boutique agencies, is that we have not traditionally been awarded that market research work on the front end. We come in when we talk about content development, creative development, and media buying and placement. We haven't even been in many of those conversations on the strategy side. And what we have to do as small business owners who own boutique agencies, as PR and marketing professionals, we need to educate ourselves on the importance of that research, so then we can be able to educate our clients and encourage them to get us involved in that beginning process. We didn't start getting involved in the market research process until the last 6 or 7 years. And we saw that. And I know people always come to me and say, if I'm introducing myself, I say, I'm Dr. Sheila Brooks. You got to brand yourself, right? So I do. Okay. And then I do have a little season on my in my age. So and getting that PhD from Howard University some 8 years ago, that enlightened me as well, because I went back to school, not because I thought it was just the right thing to do and I wanted to get a better education in communications. I specifically went back to school so I could learn more about market research, digital marketing, look at all of the digital and social media that was going on in this country, and sit in the classroom with young people who knew it better than I did. And I got that education because I'm a lifelong learner. And I thought that was so important. And I did that because I had experienced and had to pivot in another recession, that recession of 2007 and 8, because as I mentioned earlier, we were a production company. My background is television news, it's journalism. So production made sense because that's what we did. But we had to pivot into advertising and marketing and expand, because I saw that production was just one piece, one element, one category of the bigger picture of marketing. And that's what we have to do as small business owners, as public relations professionals. Educate ourselves around those areas that we don't know, like market research. Encourage our clients to get us involved, to sit at the table so that we can be part of those conversations.
And Was there, in those market research, the focus groups you did, can you tell us about like an aha moment or something from those focus groups that just really, it was that aha insight that helped shape the campaign?
Well, I think the big aha moment for all of those focus groups, the ones in Prince George's County, as well as the ones around the country that we conducted, was that what we found is so many of those participants were very, very vocal about not trusting government officials. That was the real big ha-ha, not trusting government officials, but trusting the only person they trusted was Dr. Fauci. That was it. And maybe because he was front and center, he's the spokesperson. They felt connected to him. But as far as their local, county, national healthcare practitioners and leaders and government officials, they just didn't trust them. And that was just the big aha for us, because while we knew that that would be part of it, we didn't know it was going to be that significant. They seem to trust more of the media telling the story, and certainly, of course, social media, than the media on the air, whether it was on the air with broadcast or whether it was digital and on websites. But that was totally interesting. But what the majority of all of the participants also said, which because we come from those communities, we knew this would happen. Maybe the average person may not know that they would have gotten this result, but the majority of them just felt very much racially discriminated against during that time for whatever reasons there were, whether they were trying to initially understand what was going on with COVID, ultimately to understand how and why we needed to have a vaccination, to the point that they said that they just would not get vaccinated.
That's a really interesting point, because the term, vaccine denier or vaccine hesitant, it isn't necessarily accurate if someone just has had historical mistrust in the medical establishment, or if they intend to get vaccinated and just don't have a means to do it. So how did you navigate, some of that, like broad stroke language that
Well, one of the things with the certainly there were the language barriers. When you heard me talk about Prince George's County, and we were dealing with Haitian Americans, Amharic, some other African workers, as well as residents of the county. We always, while we have English speaking moderators, we tend to look at, if we're talking to the Asian American community, Latino community, or other communities, we bring in moderators of color, so that those participants in those focus groups can feel comfortable. They're looking at somebody who looks like them. They're getting connected and engaged in a conversation with somebody who comes from their community, that can make them feel comfortable to talk openly and candidly about the issues that we put on the table. That's so very important. And then that also goes back to, when we talked about, going to community where they are, you can't put somebody that's not of color in front of audiences like that if you want them to be open and candid about the issues.
That's really a tremendous insight. Absolutely.
Yeah.
Any audience questions? I don't see anything in the chat, but do feel free to pipe up. If so, we still have plenty of time. Dr. Brooks, another point, I've heard this quote before. I don't know if you have either, or that we don't really hear about public health when it's working.
Mhm.
We only hear about it when it's in disarray or not working. Are you also, thinking about just telling the story about public health departments at all levels and what they do on a day-to-day basis, or also like how what are those lessons learned from speaking with communities? What would restore their trust in public health?
I think what one of the things that we definitely learned at Prince George's County to restore the trust is they really want to talk to people who are not just government officials, but actual practitioners. To tackle the health inequities that have become increasingly evident during this whole COVID-19 pandemic, you have to be able to meet with those people that you can connect with. And I keep saying that that's not always somebody that's a government official. It's a leader in your community. It's an influencer in your community. It's somebody from their faith community that they believe in. And that's one of the things that we actually really learned, particularly when we were dealing with COVID-19, because there's so much disbelief. If you don't trust some of the media, if you don't trust your government officials, then who do you trust? Well, what we know in so many minority communities, particularly in the Black community, they trust their faith-based leaders. So if you get the faith-based leader that can really talk about the health inequities, that can help them open up and tell their story to see how they can get the help from their local communities. People just, there was so much tension because people just didn't even believe. We had government officials in the beginning of this, as we all know, telling the world that this is not really happening. So you start off wrong. And then when you're trying to get that messaging to our communities, to minority communities, to underserved communities, then what you find is that there's this disbelief. And so I do think that what we have to do is you have to find the expertise in those communities of people that these community leaders, residents can believe in. And I think that would help tremendously. They have to identify with these folks. So, because what we want to happen is that we want to be able to advance health literacy so that diverse populations can understand just basic health information, to know what basic services are available so that they can make the right health decisions. It's important to support creating a public education and awareness campaign so that these underserved communities can understand how they can improve their lives.
Absolutely. And it's very foundational to now and to next.
Yes, absolutely it is.
Well, if there aren't any more audience questions, I will end with just one for you. Dr. Brooks, you clearly, you described yourself as a lifelong learner. So I would like to hear, how do you keep learning about the communications field? What are you reading, watching, or listening to for continued inspiration?
Oh, thank you for that question. I think that one of the important things for me as a lifelong learner is to continue to advocate on behalf of women-owned businesses, minority-owned businesses, public relations, marketing professionals. So I stay involved in organizations like WWPR. If you're not a member, become a member. We need you. That is so important that you connect with others like yourselves so that you can gain some wisdom and expertise, not only within those groups, but with all the webinars, resource of information that you can get from so many of these groups. So I wanted to definitely say that. I get mine from that, as well as the inspiration and from other, certainly podcasts and reading as much as I can about the industry and learning. And as I mentioned earlier, I went back for a PhD in 2009, finished it 5 years later, and just took one class a semester and wrote that dissertation. And then that was all that we said, and got a PhD in communications and learned so much from that experience. My service in the community that I serve on the board at Jim Vance Media Academy at Archbishop Carroll High School here in Washington, D.C., an inner city Catholic high school, the only inner city Catholic high school. I grew up in the inner city in Kansas City, Missouri, come from a very poor community, and we were to have that kind of resource and learning has always taught me the value of education. So I make sure I give back, and I'm participating in those kinds of programs. Very involved with the National Association of Black Journalists, where I have started a student project to train future aspiring young journalists in the television news industry. And you know, my best reading, I must say, is my Bible every day. It keeps me with my unshakable faith. It keeps me going. It keeps me grounded. And that's very important, I believe, to the success of my business.
Well, thank you for, again, being here with us, Dr. Brooks, for paying it forward to our PR community, but also DC and the next generation of storytellers in such a tremendous way. And I don't even think I have to do the membership plug because you did it for me. But Amanda, my board colleague in membership, is probably thrilled too. But in the spirit of just short plugs, I wanted to mention you could go to WWPR.org/events to find out what's coming up next. The most urgent thing is that we are still taking nominations for the Emerging Leader Awards. These recognize women in PR from ages 25 to 35. We're still looking for nominations in the agency category, so hopefully we get a few from SRB Communications too, and any other folks in this call, if you want to, nominate an up-and-coming communicator who inspires you, please do by tomorrow, 11:59. And then we have an event on May 10th about a book called Something Major, the New Playbook for Women at Work, with author Randy Braun. And again, you could find more information about all of that at WWPR.org/events.
Can I plug an event, Stephanie?
Yes, please. Let's open it up for shameless plugs.
Our senior leadership or executive leadership committee is hosting an event on Tuesday, May 23rd at 8:30 in the morning. We have Martha Boudreau from AARP and Jean Medina from the Washington Commanders. And they are both going to join. I will moderate that. We're going to talk about stakeholder communication and how communication ties together so many parts of plans and what the public sees. So hope everyone can join that.
Excellent. Any other plugs, any last minute questions? If not, we could end a few minutes early and let everyone enjoy the sunshine in those last few bites of lunch.
Thank you so much. Thank you all again.
Thanks, Dr. Brooks.
For the audience. We're all storytellers in this world of PR. So let's keep telling those stories, amplifying the voices of our communities. And I know when we all do that, we succeed.
Absolutely.
Thank you.
Thank you all.
Okay.